a different patient come in every 15-20 minutes with an undifferentiated problem is really quite an interesting side of medicine that I don't think you get to see much of in the hospital. Also, putting the responsibility back on yourself to test your knowledge and your skills, I think general practice really offers that to you. I like where Sturt Fleurieu covers in terms of South Australia. Do a good mix of country and metro and outer metro areas. I wasn't really interested in going too far reaching. And I also know that the educational sessions throughout Sturt Fleurieu are very useful and very handy for exam preparation. I relieved in the country for 6 weeks as the sole doctor in a small country town in Queensland. Being the only doctor in town gives you a lot of responsibility and to really test your clinical knowledge and your judgments. I enjoyed that challenge of every day seeing new things, testing your clinical knowledge and testing your clinical judgment in terms of the variety of cases you see, the acute versus chronic medicine too. It's changing. The focus of general practice before, I think some people used to think it was an easy option. I don't think it's an easy option at all. I actually think general practice is probably the most challenging specialty you can do. You really have to have good clinical skills and knowledge to participate in general practice. People are seeing it as a real career choice rather than a fallback option, which I think it probably used to be. But to me, it's definitely the most challenging specialty. Well, the things that I find challenging are not necessarily what other people find challenging. I've done a lot of general medicine in the last couple of years with my physician's training. The things I find challenging are more the obstetrics and gynaecology stuff that I haven't had much experience with in the last 3 or 4 years. The stuff I find really interesting are those general medical things, those complex medical things, and I like to work through some of that in general practice before sending them to a specialist if I can. It's all about yourself and recognising your limitations, and once you recognise those limitations, you need to ask for advice. On a day-to-day basis, you expect a lot of variability. You know, have 25 or so patients maybe booked in for the day. Every one of those patients will be presenting with a different problem. Some of them will be undifferentiated problems, and you'll have to start from the groundwork and work your way up and do some sort of differential diagnosis and organise investigations and appropriate management plan at that point. Other people are going to have really simple stuff, coughs and colds that you're going to see lots of. Everyone's different and everyone's challenging, and to interact and get rapport with each patient takes different tacts, and you have to use communication skills and non-verbal communication skills and all the tools you should have learned in the last 6 years of your training. It's a lot more clinically challenging than what I expected. In practice, well, you're the practitioner in the room, they're coming in there for your advice and they want to know what you think about what's going on. And so you really are testing your knowledge and your clinical skills and your clinical acumen. Every patient is challenging. That's what I enjoy about it though. You really get to test yourself every day in consult. Every pre-vocational doctor generally has a feeling of what they want to do or what interests them, and medicine is a career like anything else, and I think you really, if you've got a passion for something, you need to do that. If you don't have a passion for it, you move on, you try something else. Very well supported. The support is phenomenal, and I didn't expect to have that much supervision available to me, but it is. I know whenever I need assistance or help that I can either give them a call and say, when you're free, can you pop into my room, or I can go and see who's free at that point in time, and I know I'll get the assistance I need.